Hello and welcome to Didactics Online. I'm Randy Davis and I'm going to be talking to you today about balanced ligamentous tension. So when we're talking about balanced ligamentous tension, it's really important to keep hold of the key functions of what a ligament actually is supposed to do and what it does in a dysfunctional state. So a ligament is going to maintain any articulatory joint throughout the body in a balanced position. So Dr. Sutherland actually proposed a balanced ligamentous tension mechanism to hold any joint into its place within normal function. So one example would be the function of the radius and the ulna. Whenever they're functioning together, they're going to be held by the interosseous membrane between them. So whenever your radius turns, the ligament holding the two bones together will actually allow the entire mechanism to move but maintain strength as well as articulatory fluctuation. So today we're going to go over a couple different treatments for somatic dysfunctions. Within a somatic dysfunction, the ligamentous mechanism is actually disturbed. And instead of being in a normal state, you're going to introduce a dysfunctional state. So I've kind of drawn up a diagram that's used a lot of times to help explain exactly what's taking place with the balanced ligamentous tension in a somatic dysfunction. So in your normal joint, you're going to have a nice balanced state. This is going to be maintained by ligaments both anterior, posterior, as well as on either side. It's going to be a nice mechanism balancing the ligaments, the muscles, as well as the articulatory structure. Within a dysfunctional state, for example, C3, extended, rotate, and side bent right, the balance is going to shift. So whereas the balance point in a normal joint is in the dead center, the balance point is going to shift in compensation to allow the different ligaments to maintain correction around the dysfunctional state and avoid as much injury as possible. It's our body's self-defense mechanism is basically what's taking place. So through our treatment, we're going to approach this new barrier, allow the structure to relax there by engaging the ligaments and the natural motions of the body, and the tissues will themselves allow the patient's dysfunction to resolve. So I'm going to start with a pelvic dysfunction. Rudy, can you come on over to the table? And could you lie down on your back for me? So you can kind of talk about the pelvis within a three-dimensional plane, and you can review that on your own on the Didactics Online video for the pelvis. But whenever we're talking about BLT, we need to make our diagnosis first. So I'm going to say that Rudy has a dysfunction that is an anterior rotation on his left-hand side. So the left innominate is rotated forward. So now whenever I'm treating this from a balanced ligamentous tension perspective, I want to engage the ligaments. So my first step, I'm going to put one hand onto the patient's ASIS, reach around to the back to the PSIS, and actually use the entire innominate kind of as a handle to engage the ligamentous tension. So I'm going to take it anterior and posterior. I can actually diagnose from this position as well. And I'm trying to feel for motion of ease. Once I find the motion of ease, I want to back away and step to the balance point. I don't want to be at either side of increased tension or decreased tension, just dead in the center. Then I'm going to check for in-flare and out-flare, and he actually prefers a little bit of out-flare. And I'm going to feel for shears as well, so inferior shear and superior shear. And he actually prefers a little bit superior. So once I've found all three planes, I'm going to find the balance point within each, engage them individually, and then try to balance them around each other again. So I want to engage the balance of the entire 3D structure, not just of one plane. I want to hold it there and allow the body to compensate. And you'll feel a release or an ebbing of the flow of natural fluid throughout the body. That's how you know that you've reached a corrective state. So now for this next portion, we're going to go to the cervical vertebra. So the area I'm going to be treating, I'm going to be placing a finger on the back of C7, and I'm going to be stabilizing T1. And I'm going to engage motion by stabilizing at T1 with one hand and pressing on the articular pillars of C7 with the other hand. So I'm going to just be pressing right here to engage left rotation versus pressing on the left side to engage right rotation, respective of the vertebra from the front. So I'm going to go through that on Rudy here. So again, I'm going to find T1. You can go ahead and just relax there. So I'm engaging T1 with my right hand, and I'm engaging C7's articular pillar on the left with my left hand. And I'm feeling for motion of the vertebra to the left Then I'm going to switch hands and feel for motion of the vertebra to the right. His actually prefers motion to the right. So I'm going to hold that motion to the right. Then I'm going to engage side bending motion by just pressing on the spinous process and translating it either lateral or to the left and then to the right. And I'm going to just find the balance point. Once I'm at that balance point, then I'm going to start adding flexion and extension by engaging directly around the spinous process of C7. So I will flex it and I'll extend it. And his prefers flexion. So it's flexed, rotate left, side bent left. And I'm just engaging the balance point within all three of those planes. Once I hold it there, or once I find that point, I'm going to hold it there and just allow the body to resolve it on its own. I use the cervicals as an example because this is a system that can be applied all throughout the body. You can also do this on any vertebra from the lumbar to the thoracics. For the ribs, you're going to use similar motion and you're just going to engage from the back, but you also need to engage the whole body as a balance, so you're going to be incorporating the vertebra as well. So thank you for joining us today, and maybe we'll cover some other techniques like this in the future. Thank you for joining us at Didactics Online.